Next up, we have Peter Winkelstein, who is the director of the Institute for Healthcare Informatics.
Thank you very much, Jill. I'm just going to share a couple of slides here. There we go. Hopefully that works. Does that look okay?
Yep, looks great. Yep,
Terrific.
perfect.
I'm just going to give a brief introduction to the Institute for Healthcare Informatics, and then Jonathan Blazier is going to do a very brief demo to show you how it works, and so that you'll get a sense of what's available and how you might get to it. So what we have at the Institute for Healthcare Informatics is we have electronic health record data primarily, also some claims data that is available to you to do analytic research on. So you can query this data, take a look at it, and build hypotheses or test hypotheses on it. We have a lot of our local electronic health record data. We also have access to very large electronic health record data sets that are national and global. So locally, we have access to the electronic health record data from the UBMD faculty practices. So those are our own docs. Their practice, they work on, most of them work on the Allscripts electronic health record, and we have that data. There's approximately 800,000 patients in that data. And we also have access to the Kaleida data that's on their electronic health record, which is currently Cerner, both inpatient and outpatient, and there's close to 1 million patients in that data set. And we also have some claims data as well. One thing that may be valuable to you is that the electronic health record data is fully identified. This is not de-identified data, this is fully identified data. So you can ask questions about data elements that are considered to be PHI, protected health information, with the appropriate IRB approval, of course. As part of that data set, we have free text clinical notes. So those who've worked with electronic health record data know that some electronic health record data is coded. There's diagnoses, there's medications, they're all coded and so-called structured. And then there's free text data, the stuff that docs and other clinicians type in or dictate in or in some way enter without coding. That free text data often has a lot of interesting clinical value to it, but is difficult to query because it's not structured. But we've developed a tool to allow us to look through that that free text clinical data, and that tool is available to you working with us. So I want to make sure that you're aware of the fact that you can get to both structured EHR data and the unstructured EHR data. The global data sets that I mentioned are through our partnership with Trinetics, and Dr. Sethi mentioned Trinetics in one of the previous presentations. We have a partnership with Trinetics. Trinetics makes available to us EHR data from several different networks. You can see the size of these networks. So some of them are 500 million patients worth of data. This is so-called limited data set data, so not every identifier is in this, but many of the most valuable ones are, like, for example, dates of service. And this can all be accessed through the IHI as well, with appropriate IRB approval. Now, the way you get to us is to go to the website, the CTSI website that Dr. Sethi just talked about a few minutes ago. Our web presence is there with them, and select us from the list of cores there. That'll take you to our part of the CTSI website. And then once you're there, you can select under services and support. You can go ahead and select that, and that will bring you to a place to put in a request for services. You can also do that from the top level homepage as well. And there you can put in whatever it is that you're looking for and whatever you're asking, whatever it is that you're asking for. You can also reach out directly to any of us here who are part of the IHI team. Myself, Jonathan, Viraj, or Lisa, all have buffalo.edu addresses, so you'll find us in the global directory. So feel free to email us if you have any questions. So that's a quick introduction to what the IHI has, basically a great deal of EHR data that's available for you. And now what Jonathan's going to show you is how you can get started using it using our Trinetics tool. So Jonathan's going to show you, once you get access to the Trinetics tool, Jonathan's going to show you what that looks like and the kinds of questions you can ask of the EHR data. The Trinetics tool works with entirely de-identified data. So you can use the Trinetics tool to explore the data before you get your IRB approval. Because again, it's fully de-identified, no protected health information in the data that the Trinetics tool looks at. So this is an opportunity to go in, look at the data that we have, ask questions of it, see if there's patient sets in there that make sense to you. And then if there are, for which you need additional data, that's when you can go get your need to go get your IRB protocol, and then come back to us and say, now please extract the data that I need for the patients that I'm interested in. We're here to help with that process. If you have questions about how to do the IRB approval, questions about what data elements we have and which ones you should request, and then how we're going to deliver that data to you. We basically hold that for you and give you a remote machine on that, so we take care of the security of that data for you. If you have any questions about that, the best thing to do is reach out to us, and we're happy to talk to you anytime. And so with that, I'm going to hand it over to Jonathan. So I'm going to stop sharing. Jonathan, want to take over?
Absolutely. Let me see here. Hello, everyone. For those that don't know me, my name is Jonathan Blazier. I work with Peter as a database administrator, and I also work as the Chief Research Informatics Officer. So this is the Trinetics platform. I'm going to log in with my account. I'm an administrator, so the screens will be a little different for you once you log in. You can request access through the CTSA portal, and we're able to give you access to the system. It's very quick. We'll send you an email, and it will have instructions on how to log in. The whole concept of this tool is to really identify patient cohorts based on inclusion/exclusion criteria. On this screen here, I just created a demo query. I have it pinned just for this type of demo. But this is the screen which we call the query builder, and this are things that you can add to. A patient cohort must have these diagnoses. It cannot have these diagnoses, etc. And you can get pretty complex with the logic. You can do or statements, and statements, etc. I'm just going to do a very quick demo. I'm going to look up diabetes, for example. I'm going to grab the parent code. So I'm going to get all diabetics. It tells you what codes. These are the ICD-10 CM codes. You can come in here and you can kind of see a breakdown of all the children codes or related codes to that ICD code. I'm going to check that off, and I'm going to add it to the query. Now, right now, I'm actually at the University of Buffalo data set. So this is inclusive of the UBMD data, as well as the collided data, the Cerner data. So I'm going to run this query just to kind of give you what it will look like with that simple terminology. So the query will run in the background, and it looks like I pulled about 245. Hold on a second. Yeah, 245,000 patients in this data set. Now, once I have that data set, I can refine it. So maybe I want to say I want to exclude patients with hypertension, for example. Maybe I want to come in here and say I want a lab test, an A1C. So here I'm going to look for a hemoglobin A1C lab test that exists. And I also want to say I want it greater than or equal to, let's just say 8. Nice little feature is it shows you the distribution of the patients in the data set. So you can see these are all the patients. The tail here is going to be the patients that are above an 8%. I'm going to save that. I'm going to rerun the query. And now I've got down to about 6,000 patients. You can go through and it logs every single query that you've ran. So you can go back through and see what worked, and you can really have a incremental build of your inclusion/exclusion criteria to really define that patient population. Now, once that patient population is defined, there are some tools in here. I probably can't go into too many details, but you can explore the cohort. from a demographics point of view. So you'll run the Explore Cohort tool. And this is all based on that patient population that I just queried. I created a patient cohort. So this will go through. It takes some time because it has to collate all the information that you have. I'm going to kind of move on. Let me see if I can get it to run a little faster. It does take a little bit of time because there's a lot of patient information here. But the Explore Cohort tool will break down your age groups, your race, your gender, all of that kind of information. It will give you graphs and distributions of those patients in that cohort. It's very useful when you're doing analysis to see if you have enough patients to do that study. Let's see here. So once you have your population, your patient cohort identified, there's a couple options for you. So if you already have an IRB protocol in place, you can request the data set up here. Okay. And now what that will do is that will TriNetX will actually provide you a de-identified data set. It goes through the IHI, we approve it, and then the data set is delivered to you. That's one mechanism. Now, if you're going to do something like recruiting for a clinical trial, you can create what's called a patient list, and that's here. So we export patient IDs. These IDs are synthetic IDs that the IHI can identify. You provide that export patient list to us, and then we can go through and pull out the patient information based on your IRB protocol, and then provide you a space to work on that information. If it's de-identified, you can work at the IHI, or you can work with your own local data set if it's de-identified. If it's not de-identified, then it's a requirement to keep working in our IHI system to keep the data secure. And we can provide a virtual machine for you to work on. We provide the data set, any tools that you will need, such as SAS or R, Python, etc., whatever your requirements are, and we build that out for you so you can work on the specified data set and your team can also access it as well in a secure environment.
Jonathan?
Yep.
Yeah, we're a couple minutes, just a minute or so over, but I'm conscious of the time because we have other people lined up. Is there something that you wanted to finish that you could wrap quickly?
Yeah, I would just want to talk about, so I mentioned it quickly, sorry, I'm trying to hurry. University of Buffalo, here is you can choose your data set, right? So right now I have University of Buffalo chosen as our data set. If you click on that, you can see here, these are the national data sets. These data sets, you can also query just like you did at the University of Buffalo data set. The difference with these is the IHI does not store these data sets. So this request goes to TriNetX. It goes through a similar process. You have to sign a release form, and then you're able to get that data as long as you have an IRB protocol and all the appropriate documentation in place. That data set will be, as Peter mentioned, that will be the identified data set, but you're able to download that information and work on it at your leisure. And I think that's the major features.
Okay, thank you. And sorry, I'm just trying to keep us on track a bit. Appreciate you taking the time. There is also a presentation by the IHI team on the UB Health Sciences YouTube channel that was done back in the spring. So that's a great resource as well. So thank you.